Hello all, today we will be discussing the validity of Miss T's living will and how it indicates her care should transition to palliative care measures only. Miss T is a 65-year-old woman who required surgery to decrease her likelihood of having a stroke due to cardiovascular issues. She consented to the surgery and understood while this procedure should be performed to prevent future strokes, it also carried a significant risk of inducing a stroke that could leave her disabled. Miss T instructed her medical staff twice that she had a living will. She instructed them once when she scheduled her surgery and reminded them another time the day before her surgery. She stated each time that to the medical staff that she wished her living will be carried out if she experienced any mental or physical disabilities as a result of the complication from the surgery. Her living will was created 4 years prior after the death of her husband from a lingering disease. The death of her husband was clearly an influential aspect in the decision she outlined in her living will. In the living will, she states that she does not wish her life be prolonged if there is no reasonable expectation of recovery from a physical or mental disability. During surgery, Miss T experienced a stroke that has a high likelihood of leaving her with extensive neurological impairments. Physicians are now determining whether Miss T should undergo aggressive life-prolonging treatment to determine the extent of her stroke. However, since Miss T's living will is clear when she states, "If a situation should arise in which there is no reasonable expectation of my recovery from physical or mental disability, I request that I be allowed to die and not kept alive by artificial means or heroic measures." The possible effects of a stroke on the brain could affect her movement, her sense of self and the world around her, her hearing, her vision, and many other aspects that define who Miss T is. Since there is no reasonable expectation of recovery, it is clear from her living will that under these circumstances she would not like to be kept alive. This means her treatment should transition to strictly palliative care measures. Overall, Miss T's living will should be seen as another way she can advocate for herself and express autonomy over her body. Since Miss T's living will does not mention anything about a designated surrogate, her living will is the only way physicians have to interpret Miss T's autonomy and uphold her right to self-govern. Even though Miss T is currently unable to advocate for herself directly, she's provided documentation to advocate for herself indirectly through her living will. Miss T calls attention to her living will being an extension of her personal autonomy by stating, "This request is made after careful consideration. I hope that you who care for me will feel morally bound to follow its mandate." Here Miss T is asserting her own self-ownership over her own body and her personal right to determination. She hopes by speaking to the reader's own morality, they will take her own morality more seriously. By Miss T calling on physicians to feel morally bound to follow her living will's mandate, she's hoping they will be merciful in honoring her own wishes and, if needed, grantifying her a dignified death. Due to the likelihood of substantial neurological impairments and no reasonable expectation of her recovery, the only option clinicians have is to transition her care into palliative care measures only and grant Miss T her own version of a dignified death. Miss T is clear that she is not afraid to die and wishes to live a life of quality over quantity. If Miss T is not allowed her own version of a dignified death, it would remove control from Miss T. This alternative would be to perform aggressive treatments on Miss T in attempts to prolong her life. If Miss T suffers with an extensive disability, it would be forcing her to live a life she did not choose, but instead one that was chosen by a parentalistic physician that did not feel morally bound to Miss T's wishes. It should be highlighted here that people are the best judges of what is best for them as a person because they are the ones who must live with their own choices. Therefore, to value Miss T's autonomy and her expressed wishes, her care should be transitioned to palliative care measures only. The fact that Miss T's living will was created after the death of her husband further validates her living will because it highlights her first-hand experience of a death will of deterioration and dependence. This type of death is clearly not what Miss T wanted for herself, and in attempts to avoid it, she created a living will with her past experiences in mind. By Miss T integrating the influence of past experiences into her living will shows the true nature of her informed consent and decision making. In her living will, Miss T states, "I do not fear death itself as much as the indignities of deterioration, dependence, and hopeless pain." Clearly, Miss T has made a careful consideration in choosing her own version of a dignified death. She knows the true ramifications a prolonged death will bring to her and her loved ones. The experience Miss T had while caring for her husband influenced her ideal form of death and allowed her the experience with medicine to advocate for it herself. While caring for her husband, Miss T must have decided this form of death was not one she wished to experience herself, so she created her living will with clear language stating her wishes. It is clear her past experience with death molded her own version of what she would consider a dignified death for herself. This should not be taken away from her because an individual's death is a symbolic point in one's existence that can allow them a final expression of values and show the validity of the values most important to that individual. For Miss T, the value she wishes to uphold during the end of her life would be to experience her life in her current physical and mental state. The right of self-determination and autonomy should be extended to Miss T's death because it allows her full control over her entire existence and shows the true nature of honoring one's capacity to self-govern. To uphold Miss T's capacity to self-govern, her care should be transitioned to palliative care measures, and all forms of aggressive life-prolonging treatment should be avoided.
This is Catherine Anaraja. Going forward, the physician will need to identify a goal of care for Mrs. T. Goals of care can usually include prolonging life or relieving suffering. In this situation, the proposed treatments would likely lead to extended suffering for Mrs. T. It was already clarified that Mrs. T experiences pain in her current situation and has evidence of a sustained neurological disability. In this situation, respecting autonomy is very important, especially as Mrs. T has very clearly expressed her wishes. She stated in her living will that I therefore ask that medications be mercifully administered to me to alleviate suffering, and even though this may hasten the moment of death. Thus, Mrs. T has a right to a dignified death and alleviation of suffering based on her clearly stated and expressed decision. Slide 2, recording. The second counter-argument is that it would be irresponsible to remove acute care if there is a possible hope of recovery. In the case, it was described that it was impossible to tell how much function the patient would regain. Thus, it is not clear at this stage if she would resume function or not. My response to this is that based on the condition and all of the qualities that Mrs. T possesses as of right now, this treatment would still be futile. As discussed earlier in this presentation, stroke can often lead to long-term neurological disability, which is the exact situation in which Mrs. T would have wanted her treatment to be stopped. Furthermore, it was described in the case that the patient's lack of responsiveness persisted for several days, and it appeared that she might be left with a permanent profound neurological impairment. The situation has not changed as of the time that the physicians were considering alternative treatment. Based on this, Mrs. T expressed in her will that if there was no reasonable expectation of her recovery, then she would want to move to palliative care or to alleviate suffering. Thus, because of the state of Mrs. T's care at the moment, she should not be continuing acute care. To conclude, our points that physicians should not continue acute care include the following. The patient's wishes are very clearly expressed in her living will as to what care she would have wanted in a situation such as this one. She used a official legal document, and it was in the physician's possession at the time that she was receiving care. Furthermore, Mrs. T is making an experienced and informed decision based on past experience with her husband, as well as being an adult and having life experience and the foresight to create a living will for these situations. Finally, the optimal care is palliative care, or a care that in general alleviates suffering and allows Mrs. T to die a dignified death, based on what she very clearly wanted before life. While physicians may have uncertainty as to what going forward is the best decision, their best guide at the moment is the living will that Mrs. T has very carefully and thoughtfully prepared for an end-of-life situation such as this one. Thank you.